in the beginning of the pandemic, we noticed that patients with chronic diseases were the ones that had more chance to have severe symptoms, and the mortality and morbidity of COVID-19 was associated with chronic diseases. So we had that, and also the fact that these patients, they had to go to the hospital more often to do their treatment, for example, enzyme replacement therapy. So we had this need of having in our hands a group of patients that already had like these comorbidities, and also the fact that they are more exposed. We have another issue here in Brazil, that during the pandemic, sometimes the public transports were not working inter-cities. So sometimes the patients couldn't come to our hospital. So we had sometimes to reassess and reallocate these patients to do their enzyme replacement therapy or the treatment in their city hospitals, or even at their own home. So we were even contacting nursing staff from other cities to try to figure out how to do the enzyme replacement therapy in their own homes. So we had a lot of things to discuss and a lot of flow charts in terms of treatment and management. And so we have this character that is called Beto, which is a character based on our professor Roberto Giuliani, which is a famous professor worldwide in lysosomal disorders. So we have this character since 2011. And when I was a student, I kind of took Beto to myself, and I helped to draw Beto better. So it's kind of a Harry Potter saga, but with Beto. So we kind of created Beto and the coronavirus in the sense of, let's create this material that is easier to understand, that can help our patients understand both simple things like hygiene and how to wash your hands, and also how to communicate to them this new flow chart of, okay, you are doing enzyme replacement therapy, but can you do at your own place? Can you do it at home? If you can come to the hospital, can we do like once a month, and then we double your dosage? So we try to, this was the core of the booklet, to help them to understand this new flow chart of these new times that we were living. And so I came up with this idea to make it in a fun way, with a lot of activities, because patients, they stay in their enzyme replacement therapy sometimes for 5-6 hours. So we put a lot of puzzles for them to solve it and to discuss with kids.